Today, I will be presenting the topic of electronic cigarettes and how they are affecting health. Electronic cigarettes have become one of the dominant new technological advances in our society, and have grown especially popular among teenagers and young adults. The electronic cigarette was first introduced to the United States in 2006. Since its introduction, it has been promoted as a healthier substitute for smoking and a pathway to end smoking habits. The electronic cigarettes are designed to deliver nicotine with different flavorings and other chemicals to users via vapor. The health effects of electronic cigarettes have mostly gone unnoticed until recently, as new discoveries display that electronic cigarettes may not be a healthier alternative to smoking. Electronic cigarettes have become a cultural phenomenon as a substitute for normal cigarettes, but they also pose a new danger to the health of its users, as they hinder the ability of the immune system to fight HIV infection and boost bacterial inflammation. In 2015, there was a reported 2.75 million e-cigarette smokers in the US, and that number is only growing. Around 12% of high schoolers have tried e-cigarettes, while around 6.7% of US adults have tried e-cigarettes. Only 29% of smokers who tried e-cigarettes as a way to quit smoking actually stopped smoking. In a study done in 2014, as you can see from the chart displayed, Harvard University predicts that the profit of e-cigarettes is only going to rise over the next 7 years. This chart is extremely important, for as I'm going to describe later in the presentation, e-cigarettes have recently been proven to negatively affect a person's health. Nicotine is an extremely addictive chemical stimulant that is one of the main substances used in both cigarettes and e-cigarettes. Nicotine is a very powerful central nervous system stimulant, and it generally produces an aroused mental state. Nicotine increases heart and respiratory rates, constricts blood vessels, and increases blood pressure, which can lead to many illnesses. For e-cigarettes, there are nicotine-free e-cigarettes as well as nicotine e-cigarettes. The nicotine e-cigarette is used by many companies to help a smoker end their addiction. Also, both versions of the e-cigarette have begun to show some serious side effects to a person's respiratory system. Despite their massive popularity, e-cigarettes have been correlated to serious health problems, as the vapor used hinders the immune system to fight infection. In studies done by researchers at National Jewish Health, they found that the addition of nicotine in e-liquid enhanced the effects of the nicotine-free e-liquid, dampening the effects of the immune system to protect epithelial cells, causing the production of IL-6 and in turn HRV infection. HRV infection, also known as rhinovirus infection, is a common infectious agent that can result in a wide range from mild respiratory infections to more serious infections like bronchitis and pneumonia. Also, IL-6 is a pro-inflammatory cytokine that is generally secreted by T cells and macrophages to stimulate immune response, though too much IL-6 production can cause massive inflammation in areas such as the lungs. The e-liquid used in e-cigarettes enhanced the production of HRV-induced IL-6 in a test done by Zhang in 2014, which promotes respiratory viral infection in similar manner to tobacco cigarette smoking, as the immune system is suppressed by the chemicals found in the liquid. Also, a trio of toxicologists took samples of scraped cells taken from patients who had either smoked, vaped, or neither, and analyzed them to determine the effect of the ability of the immune cells in the body to fight infection. Results showed that 358 of the immune cells had significantly diminished activity in those that vaped. E-cigarettes impair pulmonary bacterial clearance, which in turn causes more infections to occur in the body. Researchers at many different institutions across the United States found that extended e-cigarette exposure resulted in airway inflammation, oxidative stress, and impaired antibacterial and antiviral responses. This impaired immune function can cause the individual who is vaping to be more prone to pathogens in the air that cause illness. Simple acts such as a person sneezing or coughing become more serious, and as a result the vapor has to be more careful while out in a public place. E-cigarettes boost bacterial inflammation in the lungs, making vapors more likely to acquire infections in the lungs. According to NYO and Ashutosh Kakkar, the acute use of electronic cigarettes for 5 minutes results in an immediate decrease of FeNO, which consequently results in an increase of total respiratory impedance and peripheral flow resistance. When a person vapes, the e-liquid burns chemicals that are inhaled. These heated chemicals make their way through the lungs, causing irritation and gradual inflammation. Also, in tests done on mice, researchers found that the e-liquid found in e-cigarettes inhibited Splunk1 expression in primary human airway epithelial cells. Splunk1 is a protein that is found in the large airways of the lungs and is aimed at stopping respiratory infection. If this protein is inhibited, the lung becomes more prone to infection. In addition, researchers at the American Physiological Society exposed mice and both human and mouse cells to e-cigarette solution that either contained nicotine or was nicotine-free. They discovered that the nicotine has dose-dependent deleterious pulmonary effects that result in loss of lung endothelial cell proliferation. Moreover, they found that nicotine-free e-cigarette solutions also included lung-harming substances such as acrolein. Every time somebody inhales the heated chemicals from the vapor of the e-cigarette, the chemicals change the inflammatory milieu inside the airways of the lungs. Additionally, bacterial pathogens exposed to e-cigarette vapor benefit. Since the vapor inhibits immune function, a common illness like the cold could become more severe, as the studies done by many researchers demonstrates that bacterial pathogens greatly benefit from the vapor used in the e-cigarette. Potential impact on health and wellness. The issues surrounding e-cigarettes have gone mostly unnoticed, as many corporations only stress it as the best substitute for smokers trying to quit. The rate at which smokers are transitioning to e-cigarettes has only increased, and with the recent discoveries of harmful side effects of the e-cigarettes, increased risk of catching diseases and having major lung issues will become more common. E-cigarettes have already made a significant impact on the world of health. Since their introduction to the world in 2006, e-cigarette users have grown into the millions, with many seeking a way to quit smoking. Vaping primarily affects the physical component of health, as it hinders the ability for the body to function properly. Vaping also damages many lung cells and affects the ability of the immune system to fight infection and disease. Relevant risk factors include the inhaling of the heated chemicals that can cause suppression to the immune system, inflammatory issues that are created through the heated chemicals entering the lungs and can result in serious infections if not careful. Moreover, addiction to electronic cigarettes is also a growing problem, as nicotine, a highly addictive chemical substance, is used in the vapor of most e-cigarettes. Nicotine-free cigarettes have also been shown to cause as many, if not more, problems than nicotine e-cigarettes. Some research has showed that nicotine-free e-liquid has a very similar effect as nicotine e-liquid, but that it also contains harmful chemicals such as acrolein, which damages the lungs. These prevention techniques that are listed are generally used for normal smokers, but can also be used for vapors. Nicotine replacement products include nicotine gum, which delivers about as much nicotine as a normal cigarette, or e-cigarette without the additional chemicals, the nasal spray, which is a prescription medication that is very powerful and delivers nicotine to the bloodstream, and the nicotine inhaler, which also requires a prescription and is made up of a mouthpiece and cartridge. Smoking cessation medications are another prevention technique and include bupropion, which is an antidepressant, and varenicline, which reduces nicotine cravings. Treatment centers are also a good way at getting aid to lower the need to smoke or vape, and community outreach is extremely important. The process of quitting can be made much easier when surrounded by support. The nicotine patch is another extremely valuable alternative to e-cigarettes. As many people who vape were previously smokers, The nicotine patch presents a way to receive nicotine throughout the body without the risk of inhaling unknown chemicals. Finally, the best prevention technique is to just not smoke at all. Smoking is one of the most preventable things in life, and so not starting eliminates any risk of harm to the body from vaping. There are also quite a lot of organizations that are striving to end smoking in the U.S. The American Lung Association is a voluntary health organization that has been researching and providing information on the different health issues related to smoking and now vaping. Also, the Truth Movement is a recent movement that directly targets the issue of smoking. They use wild television advertisements to display the issue of smoking and how one cigarette can ruin your life. Moreover, state organizations and different local movements such as Tobacco Free California and local support groups are also attempting to end smoking at the state and local level. Possible alternatives to consider. E-cigarettes have begun to show many potential long-term health issues that could plague its users. As e-cigarettes are so new though, there is still much more information that needs to be accumulated about whether e-cigarettes can truly aid smokers. The main alternative to e-cigarettes would be just to not smoke at all. Many smoke or vape as a way to reduce or avoid the stress or pain they feel. Counseling, family guidance, and exercise are all ways to limit stress and help overcome pain, so that smoking or vaping can be avoided altogether. Also, many doctors can help patients overcome their addiction to smoking or vaping with different techniques and drugs that limit the addictive effects of nicotine. In conclusion, e-cigarettes, despite their popularity, should not be used as a substitute for smoking, as recent studies have come up with some potentially dangerous side effects. Instead of e-cigarettes, use nicotine patches to help aid in the transition to quit. Nicotine patches have been very effective in hindering the need to smoke, but they also have very few harmful side effects when compared to cigarettes or e-cigarettes. E-cigarettes are revolutionary but dangerous. The vapors used in these devices hinder the body's functionality, which in turn can cause many potential health issues, such as major infections in the lungs. There are many other safer options to quit smoking in America besides e-cigarettes. And these are my references. I hope you enjoyed the presentation. Thank you for listening, and have a wonderful day.